bit, and I want to talk about insulin storage a little bit, especially during winter. People with diabetes, you don't have to really store your insulin in a fridge all the time. Once you take the insulin in a cartridge or pen, it can be kept outside for a month. But if you are not using the packets of insulin that you have, it's better to store it in the refrigerator and not in the freezer. Recently, I had a patient who came from abroad and had left the insulins in the refrigerator at home and had kept it in the freezer. They told me, Dr. Saab, we have come back from abroad. We were there for a month. Our insulin is in the freezer. Can we use it? I said no, for two reasons. The first reason is insulin should not be kept in the freezer. It should be kept in the refrigerator outside the freezer. Second, you don't know how many times the current has gone in their house. When there's been no electricity, the insulin might get denatured. The final point which I have to make is that if you are trekking with insulin on the mountains of, say, the Himalayas, you need to carry insulin in a warm place. If you don't have a flask to carry insulin and you're just with insulin and you don't know what to do, or if your flask is broken or lost, they say you must keep your friends closer, but in the mountains you must keep your insulin even closer, because at that stage the human body's warmth will keep the insulin warm on a mountain full of snow. These are some of the tips for using insulin, but one important point: if you have taken out the insulin cartridge and pen from the refrigerator, note the date. For example, if you have taken it out on 7th of December, you must not use the cartridge and pen after 6th of January. So it can be used only for a month. These are some practical tips for using insulin, and I hope you will find it useful.